Joint complaints are on a rise these days in my outpatient department. Amongst a few conditions, today we'll be discussing about one of the most important conditions that I clinically see very often. So hello and welcome back to #AskDrNamrata, and today we'll be talking about gout. So what is gout? Gout is a type of inflammatory arthritis that occurs due to buildup of uric acid in your joints. Now you must be thinking, why does the buildup of uric acid occur? So there is either overproduction of uric acid by the body or it has difficulties in eliminating it. There are certain factors which contribute to increased chances of gout. Let's see which are they. The first being diet. A diet which contains a lot of red meat and shellfish. Then a diet which is rich in beverages sweetened with fruit sugars like fructose. Also alcohol consumption, especially beer. All of these increase chances of gout. Apart from this, weight is another important contributing factor. Increased weight contributes to more production of uric acid as well as difficulties by the body to eliminate uric acid increases with increased weight. Then there are certain medical conditions, for instance untreated hypertension or blood pressure, then diabetes mellitus, certain heart and kidney affections, as also metabolic syndromes. All of these also increase the chance of gout. Then there are certain medications, for instance aspirin, then medications used to control blood pressure like thiazide, diuretics, ACE inhibitors, beta blockers. All of these also increase the chance of gout. Then certain familial histories also dispose one to chances of having gout. And last but not the least, there are certain age and gender biases. For instance, men are more prone to having gout, especially in the age group of 30 to 50, whereas women get gouty affections after their menopause. So what are the symptoms of gout that one can experience? There is sudden and severe joint pains, especially in the big toe. Then the joint appears inflamed, that is, it appears red, swollen, as well as it is very tender to touch. Some of the patients may also experience fever and symptoms like fatigue and exhaustion during the attack of gout. How is gout diagnosed? It is diagnosed on physical examination as well as medical history taking, and there are certain blood tests which are used to measure the level of uric acid. Apart from this, one can also perform the joint fluid analysis to evaluate the levels of uric acid crystals. If these crystals increase in the joint fluid space, then there are complications that can arise, or if gout is left untreated, there are complications like tophi which can arise. Tophi are just lumps of uric acid in the joint space which are under the skin or in the joint space, and they can over a period of time cause damage to the joint. Sometimes a joint fluid analysis is performed to confirm the levels of uric acid crystals. If left untreated, then gout can result into complications like tophi, which are crystals of uric acid under the skin, and these can cause joint damage over a period of time. So what are the preventive measures? Maintaining a healthy lifestyle is very essential. Avoiding food that is rich in purines, that is avoiding organ meat, that is red meat, avoiding seafood, avoiding alcoholic beverages, all of these can reduce your chances of gout. At the same time, you can try to follow a lifestyle which helps you manage your weight, which includes exercises in your daily routine. Also having an optimum level of sleep, that is 7 to 8 hours of sleep, sleeping early, trying to maintain good level of hydration. All of these can also reduce your chance of gout. So what is the homeopathic approach in case of gout? Homeopathy not only addresses the acute episode of inflammatory gout, but it also addresses the recurrency, that is prevents chronicity. There are beautiful individualistic homeopathic remedies that I use in my clinical practice. For instance, aconite, wherein there is a lot of restlessness, sudden episode of gout with fear, restlessness, palpitation. Then colchicum with shifting gout pains. Then there are remedies like ledum pal, rhododendron, guaiacum, amonphos, antim crude, picric acid, so on and so forth. There are innumerable remedies since homeopathy is individualistic. So these were just a few clinical tips for my fellow homeopathic students, and none of the medicines that I have just mentioned are to be brought by any of the viewers viewing this show. I hope this information was resourceful to you. Up till my next video, stay healthy and stay fit.